Hey everyone, good afternoon. This is County Executive Pat Ryan. I hope everyone is doing well. I was actually watching the Facebook live stream as we were getting ready, and I saw my mom join. So, hi, Mom. Nice to see you if you're still on, and Dad if you're there too. I also wanted to give a shout out. Today is birthday of one of our favorite people, Jimmy Buff from Radio Kingston. So, happy birthday, Jimmy. Hope you're enjoying the day. And as always, thanks to the whole Radio Kingston team for helping us continue to keep people informed and aware and engaged throughout this crisis and even before the crisis as well. But the whole team has been just such an important resource for our community. So thank you. Today's going to be a pretty quick and straightforward update just on how we're doing with COVID. The good news is we continue to hold steady, but my caution, as always, is that we cannot use that as an excuse to let our guard down. So please continue to be vigilant, and we'll talk more about that. But that is what allows us to keep the numbers where they are, which is in a good and steady place. So total numbers by the numbers, we are at 2268 total positive tests since the beginning of COVID. We have now crossed the threshold of over 90,000 tests. It's been 91,003 to be exact. We have had 95 fatalities, fortunately no more since our last update. And we've had over 2,000 of our residents recovered from COVID, including one that was in a hospital 48 hours ago and is now recovered, so we're down to 2 in the hospital, thankfully. As I just said, if you look at our hospitalization numbers and graph, we are at 2 residents hospitalized right now, and that again is a number that's stayed pretty much steady for the last several months, fortunately. And our active number is also looking very good. We're at 115 active cases. That's holding steady on the graph really since the end of June, as you can see. And actually, yesterday, we were down to basically our lowest level of active cases in several months. We're at 107 active cases. So overall, this is another important metric to get a sense of, at any moment, how much COVID do we have in the county, and to be right around this level of between 100 and 150 is a relatively good place for us to be. Most important metric that we're consistently looking at, of course, though, is the daily new infection rate. How many new positive cases are we seeing as we're continuing to test? And we have remained and maintained, I should say, our robust testing capacity. And so in the last 48 hours, we've tested 1,229 individuals and had only 10 new positive cases. So that puts us at a 0.81% new infection rate. That being said, so that's a good place to be overall, but that being said, I do want to give a little more context on the 10. We had 10 new positive cases today out of 757 tested, which is a little over 1%. But it's a very important caveat for everyone to understand. We are always in regular communication with all the labs that are doing this testing, and we learned this morning that these 10 new positive tests, we think there's a good chance that they are false positives. So we think probably a 75% plus chance that those 10 tests were not actually positive, but the test produced a false positive. So in those situations, what we do is we always act out of an abundance of caution, and we will retest those individuals with a fresh test, which we'll be able to expedite through the state lab, the Wadsworth lab, and we should get those results in 24 to 48 hours. The original 10 tests were from one of the private labs that operates and has been operating in the area. It's very rare that this happens, but it does happen and has happened a few times before, where for whatever reasons there's a small technical glitch and a test, or in this case a few tests, show false positives. So we are working to confirm or deny those false positives, and as soon as we know that, we'll let everyone know one way or the other. However, it just so happens that of those 10, unfortunately, one of the 10 is an individual who was in a pretty critical place as a frontline worker that will now have some additional ripple effects. So I just wanted to talk through that. One of those 10 who we believe was a false positive is a food worker in the Kingston City School District. And unfortunately, that individual had regular contact through the course of their job with really the entire food service staff that prepares all the meals for all of our students, which are being delivered, of course, given the online learning. So out of an abundance of caution, the school district, in consultation with our health department, has temporarily suspended the food preparation operation until we can get this clarified as to whether or not this is a false positive. And of course, we're doing the contact tracing and the engagement with those individuals just to be sure. So unfortunately, that not only affects these individuals, but in this case also has a ripple effect that it will be a challenge to get food out to several hundred families now within the Kingston City School District because of this. The good news is Dr. Padalino and his team have a backup plan in place. They've communicated with parents and the school community about what those options are. We, of course, and I've also offered to him our Project Resilience resources and team to make sure that no one is left in a situation where they don't have food, particularly our kids, of course. So if you are in that situation, whether it's because of this disruption or otherwise, just as a reminder, you can always call our Ulster County Recovery Service Center, which can help with COVID questions, food needs, housing needs, really any of the critical recovery needs you may have. If you are just unsure and at a difficult moment in any of that stuff, please know you can reach out and call us and talk to someone live who can help you navigate and get what you need. The number's on the screen there, 845, oh man, I've had that memorized, 433-8888. Oh man, I'm slipping here. 845-443-8888. I haven't said it in a while. So don't hesitate to reach out to that number or on our website to the Recovery Service Center. And I want to thank the Kingston School District leadership for their quick response on this and their close coordination with us. Obviously, it's unfortunate that something like this would happen, but I think this shows that we are able to, as a team, handle these situations well, to communicate effectively, to make quick decisions, to act proactively and out of an abundance of caution. And again, we'll keep everybody updated as the situation develops. Moving forward on hospital and treatment capacity, which has pretty much remained steady throughout. We have 2 individuals in COVID-19 beds in the county right now, and more than adequate capacity remaining in the short and medium term. And as always, I want to begin to wrap with a reminder that the only way that we can keep these numbers as good as they are, and the only way that we can make sure we continue to keep moving forward and slowly reopening, cautiously reopening, and trying to get back to some sense of normal is if we each do our part individually and as families and groups of friends and colleagues and coworkers, wear masks, maintain that social distancing, and wash hands and use hand sanitizer. I repeat it every time because it bears repeating. We know that this has worked here and across the state and in much of the country. So please, let's keep that up. And again, I see 99+% of people doing this. So please continue to do that relatively painless thing to keep us all healthy and safe. That is the update for today. As I said, relatively quick and straightforward and positive. So I will end at that point. I want to thank everybody for tuning in, and for everything that you've done to get us to this point and to keep us moving forward. And of course, I want to thank all of our frontline workers that have been putting themselves and their loved ones at greater risk to make sure that we can move through this, that we can stay together as a community, and that we can ultimately come out of this better, more resilient, and more equitable as a community and a county. So thank you to all of our frontline workers. Again, as I close, I'll put up the contact info for our Recovery Service Center. Please know that we, as a county and a community, we are here for you, and this is the starting point if you do have any needs, given how many challenges and pressures we're all facing. 845-443-8888. Thank you for watching. I hope your week has been good and the rest of the week is good and going into the weekend. Our next update will be on Tuesday afternoon at 2 p.m. And in the meantime, please stay safe and healthy and remain resilient through this, and we will see you next week.